Imagine you're driving to work one day, just like any other day. All of a sudden you hear squealing tires, then you feel another car hit you, and you hear the metal crunching. You could end up lucky, or you could end up with a severe injury that would take months and months to recover from. If you are injured, you might wonder who's going to help you to recover and get better. That's where a physical therapist comes in. That's just one example where a physical therapist might help a person in a certain situation. Today I'm going to talk to you about some of the training and education that it takes to become a physical therapist, some typical diseases or illnesses that they might help a person to treat, where they might work, the projected job growth, and the expected salary that a physical therapist may make. I'll start with the training and the qualifications that it takes to become a physical therapist. Start off, you need to obtain an accredited degree in either a master's or a doctoral program. According to the Bureau of Labor Statistics, in 2009 there were 212 accredited physical therapist education programs. 12 of those programs were in master's degree, and they take 2 to 2.5 years to complete. The other 200 were in doctoral degree programs, and they take 3 years to complete. Most of the classes that go into those accredited programs are sciences. The main ones being biology, anatomy, physiology, exercise physiology, neuroscience, biomechanics, and radiology and imaging. Licensing is a requirement that is overseen by each different state. Most states require the passing of the National Physical Therapy Examination. Some states also require their own additional testing. Continuing education can also be a stipulation for keeping your license. So every year, each state could say you need to pass an annual exam for that state. Explain some of the job qualifications and the education needed to become a physical therapist, and with that I'll talk about some of the work that they might do and where they might work. There are many different things that a physical therapist does in many different places that they may work. First off, they examine each different patient and do an evaluation to see what they think might work best for that individual patient to bring them up to the standards that they need to be able to live with and to try and further along the best that they can to get through their situation and help them to get to where they need to be. It might help them work on restoring their ability to move, reducing pain, restoring function, or preventing disability. According to the American Physical Therapy Association, physical therapists will work with victims on these certain injuries, illnesses, or diseases: back and neck injuries, brain strains and fractures, arthritis, burns, amputations, stroke, multiple sclerosis, cerebral palsy, spina bifida, and injuries related to work and sports. Physical therapists work in a number of different places. According to the American Physical Therapy Association, they're most likely to work in outpatient clinics or offices, inpatient rehabilitation facilities, homes, education and research centers, schools, hospices, fitness centers and sports facilities, and hospitals. Now that you know a little bit about what physical therapists do and where they might work, let me tell you about the projected job growth and the salary of a physical therapist. Job growth throughout the physical therapy field is expected to grow. Employment of physical therapists is expected to grow by as much as 30% from 2008 to 2018, according to the Bureau of Labor Statistics. That's attributed to an increase in population in the elderly, an increase in the baby boomer generation, and from their their age, it'll be more likely for them to have strokes and heart attacks, and A third is that there will be advances in medicine that result in people being able to live longer or through certain events, but they'll have a more higher need to have rehabilitation. Physical therapist salary can start at around $50,000 and go over $104,000 according to Bureau of Labor Statistics. The annual median wage in May 2008 was over $72,000. The May 2008 annual wage of the top 5 industries employing physical therapists was near $74,000 according to Bureau of Labor Statistics. Today I've talked to you about the qualifications and education needed to become a physical therapist. That every state is different, but you need to have a license, and to obtain that license you need to either first get your master's or doctoral degree. I've also talked about some of the work that physical therapists do and where they might work, that they find different ways to help people through certain situations, whether it be an injury or a disease or illness, and that most of them work in hospitals or nursing facilities, schools, or sports and recreation centers. The job market is expected to grow rapidly in the next few years. The annual average income is over $70,000. I'm sure that most people don't think about how much they would need a physical therapist until they do, but I'm sure that they're glad once they do come in that situation that they do have somebody to help them through it.